Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Team Association. So let's talk about your SOP manual. Do you have one? And if you do have one, when's the last time you looked at it and checked for revisions that you needed to make? So an SOP manual, or Standard Operating Procedures, is a great way to standardize everything in your office. Both the clinical section and the non-clinical activities of your office need to be standardized, systematized, and noted so that new hires and even existing personnel know what they should be doing and how you want it done. So what a lot of offices are doing are utilizing the videos in the PDTA website to standardize the actual methods of clinical things, whether it's sterilization, whether it's infection control, whether it's how to answer the telephone, how to greet new patients. All the different trainings that we have available to you, people are using to standardize, so everybody's looking at the same videos, getting the same information, and then you just have a staff meeting going over it and just tweak it for your own office. This way you know everybody's on the same page. And I know a lot of you have had to hire new staff members after the COVID period that we lost a lot of the team members who either couldn't come back because of school situations with their kids, or they just didn't feel comfortable coming back. So you've got a lot of new team members, and this is going to be an easy way for you to, going forward, get them up to speed quicker. So you do want to do this both for the clinical side and the business or admin side, or as we call it, the non-clinical. So just have each person keeping a little notebook, and you just want them to write down everything they do for whatever procedure it is that they're doing. So it could be somebody for hygiene. It starts from when they get the child from the parent and escort them back, and all the things they do, write them down until the patient is dismissed. And do that for all of your clinical procedures. So restoration versus a crown versus a pulp treatment, all the different things that you have. So if you have everybody who does that procedure, say all of your assistants are doing that, you can see if there's something that each one missed, and you get a very nice compilation of what the actual process is for that procedure. So do that for everything, whether it's answering the phone up front, how to put somebody in the computer. Just really make sure everything is systematized and noted in your SOP. Now, another great benefit of that is, especially in the clinical area, you can actually ask them to also time these procedures. So you can kind of see if you are actually doing the procedures in the time allotted, what you think they should take. So doctor, if you think this should only take 30 minutes, then you schedule them for 30 minutes, but it consistently takes you 45, that's a good thing to know, right? So you might want to adjust your schedule for that, or change your efficiency and find out what the problem is that's making it take longer than you think it should. So you'll get great information besides just updating your SOP. So once that's all done and everybody's got that figured out and you've got everything down and typed up and ready to go, make sure the doctor, you check it too and see if there's anything that you think that they're missing, because you kind of know what you do on your side and you want to make sure that that's all in there. So once that's all up to date and it's exactly what you guys are doing, then you can take a photo of the tray setup, take a photo of the room setup if you've got that, whatever you want to do to make it easy. For the non-clinical, they can do screenshots of the different computer screens that they need, or the places on the computer where they need to go. So you make it as easy for somebody coming in to get up to speed pretty quickly. And then you can just keep that online in your own office, in your documents, or wherever. Or, and I encourage you to do also a print out SOP manual on paper that's in a nice 3-ring notebook, one for the clinical side, one for the front office, maybe one for insurance, however you want to do it. But keep them available so somebody can just pull that down and look at it and be able to help. So that's a great way, especially in sterilization, to make up trays or however you do it. You want to increase your efficiency in the office, and having an up-to-date SOP manual will help you do it. This has been a Practice Pro from the PDTA, and I'll see you on the next one.